The criteria for a major neurocognitive disorder are quite simple and can be captured in the mnemonic diary. First, there needs to be a clear decline in cognition. Most often, this takes the form of memory loss, although other cognitive domains such as language, attention, and the ability to plan are often impacted as well. In clinical settings, a variety of bedside tests, including the Mini Mental State Exam, or MMSE, and the Montreal Cognitive Assessment, or MoCA, can be used to provide a standardized assessment of various cognitive domains. This can be helpful not only for establishing the initial diagnosis, but also for tracking progression over time. Next, these cognitive deficits must be severe enough that they lead to functional impairment. In early stages of dementia, this is first noticeable when it comes to instrumental activities of daily living, or EADLs, which are more complex tasks such as shopping, housekeeping, accounting, food preparation, and transportation. You can remember these using the acronym SHAFT. As dementia progresses, impairment is seen in even more fundamental areas known as activities of daily living, or ADLS, which are basic self-care tasks that a person must do in order to survive. These can be remembered using the acronym DEATH, which stands for dressing, eating, ambulating, toileting, and hygiene. Use the DEATH SHAFT mnemonic to memorize the ADLs and IADLs, as these will give you a structured way of assessing functional impairment in clinical settings. After establishing both a cognitive decline and functional impairment, you need to rule out delirium as a possible cause. Delirium is an acute state of confusion that can present similarly with memory loss and other cognitive deficits. However, it's not permanent in the same way that dementia is, and will generally resolve once you've treated the underlying condition. Because of these major differences in both prognosis and treatment, ruling out delirium is essential. Finally, you need to make sure to exclude other psychiatric conditions like depression and schizophrenia as possible causes. These disorders can sometimes mimic dementia as well, especially in the elderly, where symptoms like impaired concentration or lack of motivation can easily be mistaken for dementia. Provided you have done all these things, however, a diagnosis of dementia is appropriate.